Identify the four key components of growth and development. Number one, physical. The growth and development of the body's muscles, bones, energy systems, and nervous system. Two, cognitive. An individual's ability to interpret and process information and the introduction and establishment of a person's self concept or self awareness. Three, social. The development of relationships with peers, friends, relatives, adults, and others in the quote unquote outside world. Emotional. An individual's ability to manage and regulate emotions such as motivation, pleasure, empathy, fear, anxiety, and anger. Describe the various ways of measuring age. Number one, chronological age. Age measured in years, months, and days. That is the standard use of the term quote unquote age. Number two, skeletal age. Skeletal age is determined by the physical maturity of bones, particularly through ossification, the process of turning cartilage into bone. This is typically measured using an X-ray of the hand and wrist, while standard skeletal age is aligned with chronological age. Factors like nutrition, disease, and major bone injuries can cause skeletal age to fall behind chronological age. Developmental age. Developmental age reflects the combined physical, cognitive, social, and emotional maturity of an individual, gauged by their capability to perform tasks beyond their chronological age, like a 7-year-old with the tennis skills of a teenager. Identify the four main stages of physical growth and development from infancy to adulthood. Number one, infancy slash toddler, birth to birth to 2 to 3 years. Infants rapidly grow in their first year, tripling their birth weight and increasing height by 50% with significant brain development. They develop motor skills like crawling and walking. Toddlers continue to grow and improve motor skills, mastering walking, running, and more complex tasks like using utensils and riding tricycles by age 3. Childhood, 4 to 10 years. Childhood from 4 to 10 years is a period of steady growth. Early childhood, 4 to 6 years, sees modest growth, while mid childhood, 6 to 10 years, features more consistent bone and tissue development. This stage is key for motor skill development. Kinesiologists focus on the 4 to 6 age range, knowing challenges in integrating varied sizes and abilities in sports. Experts stress the importance of unstructured, imaginative play for healthy development during these years. Puberty slash adolescence, 11 to 18 years. Puberty between 10 and 15 years brings physical and psychological changes, including sexual maturation and differences in height and weight between genders. Adolescence involves adjusting to these changes, focusing on social, behavioral, and identity development. Number four, adulthood. 18 years and older. In adulthood, height growth ceases, but aging brings changes like weight gain, reduced oxygen capacity, higher blood pressure, and resting heart rate, and also weaker joints. Regular exercise and a balanced diet are crucial for mitigating these changes and preventing age unrelated illnesses. With consistent physical activity, a healthy diet, and a positive attitude, adults can maintain a healthy lifestyle into old age. John Pigot's theory of cognitive development outlines four key stages that individuals go through. Number one, sensorimotor stage, birth to 2 years. Infants learn through motor activity, developing object perm- permanence and beginning language skills. Pre-operational stage, 2 to 7 years. Children use symbols like letters and numbers, develop language, memory, and imagination, but have limited ability to see others' perspectives. Concrete operational stage, 7 to 11 years. Logical thinking and problem solving abilities emerge, including understanding conversation, reversibility, and developing empathy. Formal operational stage, 11 to 15 years. Adolescents solve abstract problems using logic and understand abstract symbols with occasional egocentric thinking.
Describe the three stages of motor learning. The cognitive stage. In the earliest stage, beginners gain some basic understanding of the task. When a child is learning to play soccer, for example, some simple cognitive problems must be addressed, such as understanding the basics of playing the game. Example, avoid touching the ball with the hands and arms for most of the games, and so on. Number two, associative stage. This intermediate stage can be considered the phase in which learning begins to refine the skills. Learners develop an awareness of the mistakes they are making, which leads to fewer and less pronounced errors, better passing and scoring skills. Number three, autonomous stage. In this stage, a skill becomes, as the name suggests, almost automatic. The person is able to just do the activity while concentrating on highly refined aspect of the skill. Next up, we have described the three stages of skill development. So these are the same stages as the motor learning stages. However, where it differentiates is the general skill development encompasses a wide range of skills, including cognitive, motor, and interpersonal abilities. It's not limited to physical tasks and often includes the acquisition and refinement of knowledge and behaviors.
Describe the role of feedback in skill acquisition. Feedback is vital for learning and improving any skill. It helps individuals understand what they are doing correctly and what they need improvement on. Effective feedback should be specific, timely, and constructive. There are two types of feedback: intrinsic, internal feedback from the performer's own senses, and extrinsic, external feedback from coaches, video, analysis, and other things. Both are important for different reasons and stages of learning. Explain the basic principles of sports psychology. Sports psychology focuses on how psychological factors affect performance and how participation in sport and exercise affect psychological and physical factors. Key principles include goal setting, motivation, anxiety and stress management, focus and concentration, and visualization and mental imagery. Understanding these principles help athletes to improve their performance and handle the pressures of competition. Mental fitness skills. An athlete's ability to optimally regulate thoughts, feelings, and behaviors and act in a purposeful and consistent manner while coping with the many demands placed on them. Mental fitness helps an athlete maximize performance, engage in quality training, and maintain a healthy level of mental well being. 5. Different coaching styles. Number one, authoritarian. Emphasizes strict rules and discipline with unilateral decision making and a focus on obedience and performance. Businesslike, goal oriented and organized, prioritizing efficiency, results, and strategic planning. Nice person. Focuses on building positive relationships, supportive and empathetic, encouraging collaboration and open communication. Intense. Passionate and demanding, motivating through high energy while close monitoring and high expectations. Easygoing. Relaxed and flexible, promotes autonomy and self discovery in a low pressure informal environment.